The World Health Organization has declared the monkeypox virus a global health emergency. The UN body says the virus has spread across more than 70 countries and could spread even further if not tackled properly. An announcement of this magnitude was last heard back in January of 2020 when COVID-19 was declared as a global emergency. The chief of the World Health Organization warned that a lack of response could mean that the virus may spread to other countries. The U.S. Center for Communicable Diseases says more than 16,000 cases have been detected.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter's Medical School. He also has over 20 years of experience in communicable disease control and infectious diseases management. He joins us now from Bath. Doctor, always a pleasure having you on the show. I do enjoy our conversations. All right, I was talking to Dr. Capobianco from the World Health Organization Foundation last hour, and he was saying that this virus can spread through ulcers, lesions, or sores. But I think as we're still in COVID days and we're seeing a spike in cases of the coronavirus around the world, I have to ask, is transmission through the air of monkeypox a possibility?
It is never an impossibility. So everything is possible, but mostly this is skin to skin, person to person contact. But nothing in the world is impossible. So if there was an unusual specific setting where a large aerosol was created, which was laden with monkeypox virus, which then landed on somebody's skin, broken skin, or on mucous membranes, then it is theoretically, of course, possible to get infected by the aerosol route.
Okay. As far as I understand, asymptomatic infection has been reported, but is it clear whether people without any symptoms can actually spread the disease?
It's unusual, and the reason why I would say it's unusual is the natural history of this infection is you start with a fever, generally unwell, and then at that stage you could argue that you were without symptoms. But then later on, you do go on to have those macules, that pustules, that little eruptions on your arms and central area. So therefore, in the early stages, where you've only got the fever and nothing else, and the spots have not appeared yet, you could technically be transmitting before the spots have arrived.
Okay. Do you think that because of the widespread criticism around how the World Health Organization sort of handled the coronavirus pandemic, it wanted to kind of play it safe with this outbreak because there wasn't even a consensus within the WHO committee?
Yes, I can see that. And to be honest with you, I personally feel better to act fast, better to act early, better to be even premature in your actions, because this is wholly preventable and we can prevent it, control it, and eliminate it. But if we don't act fast, early, and decisively across the world, this can become a continuing problem. So I personally think even if it is premature, it's not a bad thing, because we need to act fast and early. If we're going to get good results, always act fast and early.
Talk to me about your thoughts on whether or not the window for containment of monkeypox is closing, and if it could become endemic in places that we're not used to seeing it, like Europe or North Africa.
So at the moment, we have about 3,000 confirmed cases. And about a month or so ago, I was saying we need to be very fast and decisive in our actions, which is isolate, trace, contact trace, immunize target groups. And if we had done all those things then, we would be in a better place. Even today, we haven't lost control because it's only 3,000 cases across the globe. But we must act fast and early, regain control, and then forget about it. That's the better way to deal with it. So we need to produce the second and third generation vaccines from either the smallpox version or monkeypox version and use them amongst contacts as well as essential healthcare workers, and be on the lookout for these cases and do our surveillance and contain people. If we do all those things that the WHO suggests, we will get there, we will be in a better place.
Okay. Dr. Bharat Pankania, thank you for your time this Saturday evening. I do appreciate talking to you always.
Thank you.